I'm Shabbat Simran Adenergy, the co-owner of the Birthing Tree, and a nurse midwife and a mom myself. And I wanted to say, first, congratulations. If you just found out you're pregnant, I wanted to talk to you about a few little tips and things that you can think about in these coming weeks. So the first thing is just getting out of the way some of the basics. Now that you know you're pregnant, you're probably around 4 to 6 weeks. That's usually when people miss a period and then discover they're pregnant, which is already confusing in itself. How can you already be 4 weeks pregnant if you just found out? So they actually tack on another 2 weeks to the time of conception, which is interesting. So pregnancy really lasts 40 to 42 weeks instead of the average 9 months that we think about. The first thing on your mind might be, what should I stop doing? So the biggest thing is that the baby's nervous system is being developed in those first weeks. So avoiding stimulants of any kind is a really good idea. So that might be smoking and drinking, most obvious, but also caffeine. So if you're drinking lots of coffee or black tea during the day, maybe bringing that down a little bit. So think about ways in which you can kind of clean up your lifestyle, essentially. So something else to add to your diet would be a prenatal vitamin. So you can get them over the counter, any one you choose. The one debatable point is the folic acid, which is in a prenatal vitamin. Many providers now suggest getting a folate versus folic acid, saying that the folate is more digestible and absorbable by the body. So every now and then you find a prenatal that has folate in it, but otherwise you just take your prenatal and then buy a folate in addition to that. The next thing to think about is finding a provider. So who's going to care for you in your pregnancy? So it sounds easy enough, like just go to your doctor or midwife, but it's really important to think about who you choose as your provider. Lots of things are determined by that, where you might have your baby, what kind of choices you're offered in pregnancy. So we created a great infographic that you can look through that kind of helps you pick a provider. So tune into that because that'll really help you if you've never done this before. The next thing I want to touch on is the kind of what we call discomforts of pregnancy that can be pretty overwhelming. Number one is the exhaustion. We can feel so tired in pregnancy. Even getting 10 hours of sleep at night doesn't do the trick. Naps during the day feel essential. So follow your body's lead, especially if you have a work schedule that allows for that. Rest, rest, rest. The body is just taking all your nutrients and energy to grow that beautiful baby. So follow its lead. The next thing is this nausea or morning sickness that many people experience, and I think is not very accurately described as morning sickness. It's really nausea and vomiting of pregnancy because it can go throughout the day and the night sometimes. So a couple of tricks is to really watch your blood sugar. Frequent small snacks of protein can really help you regulate your blood sugar and keep that nausea at bay. There's also some other tips which I'll include in the blog below, but aromatherapy can be great, ginger of course, homeopathy can really be wonderful. There's lots of little things to complement your blood sugar regulation and help that nausea be manageable. The next thing I want to touch on is the hormones of the first trimester. If you thought PMS was bad, the first trimester can be really intense. It's a little bit of a roller coaster as the body increases its estrogen, the HCG, which grows the baby and comes from the placenta. There's lots of hormones just fluxing through the body. So some days you might be crying and other days you're blissed out about pregnancy. It's normal. So stay with that roller coaster and be patient. It will equalize around the second trimester. So around that 12-week mark, things definitely change. Often the nausea will go away and often the hormones will steady out a little bit. Lastly, let's think about when to tell people. It's been pretty common that people just announce it right away, and I really love for you to honor this time as a special time between you and your partner, or if you're single, maybe between you and a couple of friends. It's a really special time of pregnancy, and there's a lot of unknowns. So take your time and work through those emotions and tell people when you're ready to share your good news. If at any point these discomforts of pregnancy feel overwhelming or out of the scope of normal, please ask for help. If you're having nausea that lasts all day and you're vomiting really regularly, you may need to see a provider for a condition in pregnancy. Or if your emotions are running really high and you're finding you're tearful all day long, that's something to reach out for help for. And prenatal depression is not totally uncommon. So seek a provider's help or please call on us. We'd be happy to be a resource for you, and we have a number of people who we can refer you to too. So use us as a resource. We'd be happy to be of service to you, and we look forward to hearing from you soon. Take care.